All right. Well, good morning, everyone. It is a fantastic Monday morning here at Healthline Markets. Thank you guys for being on the call. It is 9:02, and we are coming to the end of OEP, open enrollment period for Medicare. And we're going to talk a little bit about what you should be due to closing this selling period, also getting ready for quarter two, Q2. And all the great stuff that comes with it. We also have a special guest from Village Medical today, Miss Casman Mosby, and we'll have her on the line here in just a few minutes as well. And so we're going to start how we normally start. We are here to improve the lives of our community with affordable healthcare. Thank you for being a part of that mission. And thank you for always keeping one foot in the classroom and the other one in the field at all times. We're going to start with our training calendar. So I'm going to open that up here this morning. Here we go. And the training. All right. So this week is a busy week for training. I love it. So it's a great way to get ready for Q2 if you want to get a running start. We've got lots of great training this week. First thing this morning at 11 a.m., Humana is doing a dental, vision, and hearing training. Very, very important, especially as your members start to use their benefits. This is going to set you apart if you're really understanding and getting those benefits used by your members. Also today at 1, Aetna's doing a marketing studio training. This is really key and critical if you're using the carrier marketing studio assets, things like flyers, business cards, banners, tabletop stuff, which is very, very important for us now until the end of lock-in. So check out that. That's today at 1. And then there is a Why UHC video posted at 4 o'clock today. You can check that out. Why you should sell UHC. Again, another great training there to make sure that you are up and up on United Healthcare. Moving over to tomorrow, Cigna's got their virtual office Medicare questions. That's happening throughout the week here. We are doing a new agent training. That's going to be hosted at 5235 West Colonial Drive. And that's set up by Tom. So if you are new to HPM or you feel that you need some TLC, come on by tomorrow at 9:30. Again, the link is in the training calendar. If you need help, shoot us an email, support@askhpm.com, or give us a call, and we're happy to help there. Also tomorrow, Humana is doing their DSNP webinar. It's also in Spanish at the same time. That's at 1 o'clock. And there's another Aetna marketing studio training at 3 o'clock tomorrow. Moving over to Wednesday, the 29th, Ask Al, a virtual coffee session, coffee and chat, 9:30 on Wednesday. Any questions, anything that you need to be successful, Al is going to be at your disposal 9:30 on Wednesday. Also on Wednesday, 11 o'clock, United's doing their out-of-network dental benefit training. So what happens when your members go out of network for their dental or have questions about out-of-network dental coverage? You can check that out on Wednesday at 11. Also on Wednesday, Cigna's doing their virtual office session at 12:30. Make sure that you know that. Another Aetna marketing studio training, lots of those this week. That's again at 1 on Wednesday. And then for you socialites out there, if you're in the Orlando area, Optum and WellMed Mixer is at 5:30 on Wednesday. That's going to be hosted at Ace Cafe downtown. You can go check that out if you're in the market there. Moving over to Thursday, 10 o'clock, Aetna's got another marketing studio training. They're really doubling down on this. Lots of training this week on that. Devoted's got their coffee and chat session, 11:30 on Thursday. Humana, their spending account card. This has been a really, really, really hot topic that's happening across all carriers. We just had a conversation this morning about how those spending accounts work and all of that. So Humana's doing their training Thursday, 1 o'clock. Check that out. This is a big part of how you can market and capture leads, because those folks that understand how these spending accounts work are getting the business. So think about that. Check that one out. Also on Thursday, 2 o'clock, we are doing a live training on Medicare Shop and the Spark platforms. So check those out. Super helpful, especially when moving into 2023, 2024. Get off of paper and get organized so you can be the most efficient agent possible. Jumping over to Friday, we've got Humana doing another spending account. That's at 10 a.m. Again, make sure that you've got everything linked and synced with that. And then 11 o'clock on Friday, Aetna's doing that marketing studio training one more time. And then final training for the week is United Healthcare's virtual office session from 3 to 5 on Friday. There's nothing better than closing out the week than a virtual office session on Friday at 3 o'clock. It's there if you need it. It's the close of OEP, and it's the last of the daylight on getting your applications in and getting ready for OEP. So those are the trainings for the week. We're going to have lots and lots of trainings. If you have training suggestions, please send them our way at support@askhpm.com. We want to ensure that you are as smart as possible so you can go and help as many people as possible. So this week is the last week of Medicare open enrollment period. Remember, if a member has made a selection in their plan in AEP, they have the opportunity to make one more change right now for OEP. And that window is closing this Friday. All applications have to be in by Friday at midnight. Remember, if you're using Medicare Shop, you have nothing to worry about. Your applications are submitted that evening automatically, and we take care of the rest for you. So if you have any leads, if you have folks that you've been talking to throughout the last 3 months, if you haven't talked to any of your members since November, December, shame, you really got to talk to them, because if somebody's upset, this is the chance for them to make one more change, okay? So please make sure that you talk to your members, make sure that you've talked to all your leads, all your prospective folks that were interested in possibly talking to you about the health plan. This is the last week to make that final change for 2023. Yes, there are SEPs available, and we're going to talk about that on the next call, but make sure that you are absolutely prepared for closing OEP and getting where you need to be, and getting the last applications in before Friday, so you guys can have a wonderful weekend on the 1st. So there it is. All right, this morning, I do want to point out on Medicare Shop, I'm going to go ahead and pull that up here. A couple of things that has come to our attention that just need a little bit of TLC. So when you're on the plan page here and you've gone through your preferences, you've set up your member's account, and you get to the fun part where it says, hey, these are the plans that this person qualifies for. I just want to remind folks, because we're getting questions, where are the special needs plans? Why aren't they showing up automatically? Okay. Now, as a reminder, up at the top, Medicare Shop has a disclaimer for everyone there, and it says dual eligible special needs plans are for people who receive both Medicare and Medicaid, dual eligible. Premiums depend on your level of extra help. They must continue to pay their Medicare Part B premium unless it's covered through your state Medicaid program. If you receive Medicaid cost-sharing assistance, you pay nothing for medical deductibles, co-payments, and co-insurances, okay? Just a reminder there, because some of these D-SNP plans are showing that there's a premium involved. Just know that that's not always the case. They are covered by Medicaid and LIS. So, but what we're also getting question is, okay, I put in everything, but I don't see the D-SNP plans. Just remember that this is the number, this is where you've got to press it, add all special needs plans. And once you do that, it will show up all the D-SNP plans in order based on what you put in for that member. So based on their providers. And so you can filter out what plans are going to be best based on what they're looking for. If they're looking for a specific carrier, you know, if they're looking for freedom, or if they're looking for, C-SNPs instead of the Medicare, Medicaid, or you can just look at Medicare, Medicaid, and you can quickly filter the plans that are available for those folks. But if you don't have the special needs plan activated, it's not going to show your special needs options. You can see these are the regular core plans here. Just remember to keep that loaded and ready to go. The other thing too that I'm not able to show because I don't have an application up here is the PCP. Now, although Medicare Shop has a search and destroy feature for adding the primary care doctors, please make sure that when you're adding the primary care doctor on the application, that you not only have their name, but you also have their writing or their NPI, their provider ID, loaded into the system for that particular carrier. So if, for instance, you're writing devoted and you type in the doctor's name, but you do not put in the doctor's provider ID, this could cause an issue with aligning your member with that particular provider. So please take the time to bounce out to the carrier website, look up the provider's ID number, and place it on the application. If you fail to do this, your member may not get aligned with their doctor. The ID is going to come with the wrong doctor on it because it's going to be auto-assigned because the ID was not on there. So we don't run into this often, but just slow down, make sure that you put the ID on the application. It only takes an extra 30 seconds to look it up. And so make sure that that's in that space where it says provider ID. We also realize that there's some carriers that have both a provider ID and a center ID or an MSO ID. Please make sure that you look up those as well. I think Aetna specifically asks for both. I think there's a couple other carriers that ask for both. So just make sure that you're plugging those in. Please take the time to do that. We don't want to have any issues with applications going through. The PCP is not identified. The member gets their card and it's the wrong doctor on it. So then what you have to do is you have to call with the members to customer service and get that PCP changed. Now, if you're using the Spark platform, member services can handle that for you. We'll take care of it. You don't have to do it. You can go back to selling. But we want to avoid that issue because it's just going to be clumsy for your member and they're going to associate that mistake with maybe they're thinking that you didn't know or you weren't listening to what they said. So it all comes back to agent error. Unfortunately, we're always the one to take the blame on there. All right, last thing I want to share with everybody very quickly this morning is thank you to everybody that came out to the advisor meeting last week at Drive Shack. We really appreciate it, but for everyone else that wasn't able to attend, the National Council on Aging has a website called benefitscheckup.org, and this is our preferred website in order for you to look for extra help for your members. And I'm going to do a very quick demo here. So in the state of Florida, I'm going to put 32801 just as a zip code here. I'm going to select which benefits I'm looking for. So I'm looking for healthcare and medication. I'm looking for housing, and I'm looking for veterans programs for the member that I'm helping at the moment. And rather than bouncing out to 3 or 4 or 5 different sites, I found very quickly that there were 50 benefits in 32801 based on that information that I plugged in. 18 for healthcare. The big one for Medicaid is here. We talked about Medicaid redetermination last week and the week prior. So if you need an update on that, please go back on YouTube and watch our videos on that. But the Medicaid is here. You can help folks apply online and it'll bounce you out. Since I'm in Florida, it took me right to the Florida Medicaid site and I can look up Medicaid redetermination information there. So see how quickly I can do that. But just so everybody can see, it's not just that, it's LIS, and then we look at different programs that you might not even know existed. So really cool resource center for you to become a community resource for your members and prospects without feeling salesy, right? Go out and help the community and the leads will come. With leads comes sales and sales comes commission and commission equals a full bank account, which is what we're after to make sure that you can help as many people as possible. So with that, we have a very special guest. Hopefully she's on the line here. I don't see her, but Kasman, are you on this morning? Can you hear us? Do we have Kasman from Village Medical on this morning? No, don't have her yet. So I know Nick, you're on the line. If you want to try to reach her or help her get on, that would be great. In the meantime, I had a chat here. Can you put the link to that site in the chat? Absolutely. It's super easy. Benefits, plural, benefits checkup.org. Save that as your new favorite website. One thing that I do want to go back and point out too, and let me put this back in my share screen here.
Hey, Justin, it's Nick. She's
Hey,
not
Nick.
going to make it this morning.
Oh, okay, no problem. We could talk about benefits checkup instead, so I appreciate that. All right, so going back over to benefits checkup, here we are. So when you land on the website, you could literally put in any zip code. It doesn't have to be Orlando or Florida at all, okay? So wherever you pull it up, we're actually in Miami right now. What's a good zip code here, Sergio? Good zip code in Miami.
32837. I'm sorry. 33193.
331
93.
33193. So we're going to put in Miami. Now this is going to be similar because a lot of the same things are running in Florida, but it is also zip code oriented too. So discounts and activities, long-term care, food and nutrition, whatever benefits you're looking for, you now have become the go-to person, the go-to guy or the go-to gal for anything, disability services. And you can run this not only to your members, but if you set up a table, you're not just going into places as, hey, I'm an insurance agent. You're going into places saying, hey, I'm a community liaison for extra help programs. Let me show you what I can do for you and your people. So this is great for going into doctor's offices. This is great to going into places where there's a ton of agents and you can't get in because there's a ton of agents or they already are working with an agent. You're going there to say, hey, this is something I do for free, right? Free. But people are walking up and they have Medicare, right? So you're the person that helped them apply for extra help. And so just in this example with me checking a few boxes based on what my member or my prospective member had told me, here in this market, there's 27 different benefits and resources available. One thing that I really like too is this create my report. So if you want to email this over to maybe a power of attorney or you want to send it over to the member, you can click create my report. And you can actually make it in English or Spanish and then add, oh, you know what, she said something about income, or you know what, let's add those Medicare and Medicaid benefits there. And it shows, you know, there's 18 programs for healthcare and medication, 7 for food and nutrition, 6 for disability services, and then you can open it up to see what those programs are, right? So what is ICANN Connect? I have no idea. I'm going to open that up. And this is a program that you can help. This is just one example here. It says, if you have both vision loss and hearing loss, this program can help you obtain special equipment called assistive technology at no cost. The assistive technology offered can help you with daily life activities such as communicating and reading. The program provides many types of equipment, such as portable braille machines, widescreen computer monitors, speech-enabled software, mobile devices, and telephones. The program will provide a specialist who lives close to your residence to help you select and install equipment that will best meet your needs. You will also receive training and technical support on the equipment you receive. So just with that one benefit right there, I could then go to places that help. In Orlando, we have a place called the Center for Independent Living. And these are folks that are, they might be speech impaired, they might be hearing impaired, they might be vision impaired. And you can go in there and say, hey, are you aware of the I Can Connect program? Would you like me to help your patrons apply for the I Can Connect program? And you're the person that's doing that. Everyone in that center that walks through that door is disabled or has a disability, and most of them are already on Medicare. So right there is a lead source just from a program that I just showed you how to get to it, and you can fill out this application, okay? So it gives you a lot more materials. It gives you a lot more resources to go into places that normally, if you go in and say, hi, I'm an insurance agent, you're not going to be able to get in, right? You can actually set up this report in both English and Spanish and send it to those folks that need it. You can download the report, or you can go ahead and email it as well. So I want to name this report Miami Benefits. Click download my report. And then what it's going to do is it's going to create a PDF. Okay. And I got to share that PDF with you so I can show you what that's going to look like here. Let's go over here. Where are we? Here we go. Okay, so we're going to share our screen. And up here is what the benefit report looks like. So I named it Miami Benefits. You can name it like your client's information, like Justin's benefits or Justin's entitled benefits. And you can see these are the benefit categories that I selected for this report. It created a table of contents for me. And look at that. There's Medicare right there. On page 14, I can click it and it takes me right to the page. Talks about Medicare, right? So all the different programs are organized very nicely for you, and it makes you look like a superstar. So you can download it like I did here. You can also go to, let's see, if you go back, you can email the report to yourself as well, or you can email it right to the person. So if you're talking to the power of attorney, or if you're talking to your client, and you're like, hey, I'm going to create a report for you to review. Let me go ahead and send it over for you. But really listening to your members and understanding what they're looking for is going to drive not only the satisfaction and the retention rate for you, but it's going to drive referrals. The number one lead source in this business, if you do it right, is referrals. No doubt about it. So get out in the community. You have a tool and resource now. I'm just so excited about this tool because you're doing two things. Number one, you're going out and you're really helping people that really need the help right now, right? It's allowing you to get into places that you normally couldn't get into. You're not an insurance agent anymore. You're a benefit consultant. You're there to help people apply for extra help, and it's going to drive leads and sales and referrals to you. Okay. If you don't know where to start, go back through your book of business and have a conversation that sounds exactly like this. Hi, Mrs. Jones, this is Justin. How are you? Just checking in. How's that new health plan working for you that I signed you up for an AEP? Great, things are working fantastic, wonderful. Well, I was calling you today because I wanted to let you know that there's some extra help programs that are out there that can help you with things like housing, utilities, food, medications, healthcare. Do you know anyone that I might be able to help? Does any of that ring a bell for somebody, maybe a neighbor or family or friend that I can help apply for benefits? Sometimes the client will say, yeah, me, I want to apply for benefits. Or they might say, yeah, you know what? My sister just moved here from Connecticut and she doesn't know anything and she needs extra help. And there you go. You've got a lead, right? So can you call this person? Yes, because we're not talking health insurance. We're calling them to say, hey, Mary, I got your information from Mrs. Jones, and she told me that you were interested in some extra help programs, and I'm here to help you with some of these programs. So you can actually call them and help them with extra help. You can't talk about insurance, you can't talk about Medicare. If they bring it up, then absolutely you can go ahead and do a scope of appointment or whatever you need to do at that moment. But this gives you the ability to have some resources at your fingertips to really help the community go out there and do the right thing. So benefits checkup, play around with it. It's by the National Council on Aging. This is our recommended website for extra help. And depending on the state that you're in, if you're doing Medicaid, you can go ahead and it'll pull up only those benefits in that zip code. So you're not getting any misinformation. So really great website. Happy to share that with everybody and hope you guys use it. The last thing that I wanted to share with you guys was an email that we got from Freedom. And so Freedom sent out a thing here about best practices when calling agent services. And I know many of you are calling to check eligibility for Medicare and Medicaid. It's pretty much the fastest way that you could do it. But I also wanted to remind you that there's some other services available through agent services at Freedom and Optimum. So this is both Freedom and Optimum. And just want to go through that with you as well. So here's some helpful tips to remember when calling into Freedom's agent support team to ensure that you're getting timely and accurate information. The first thing is when you're calling in for Medicare and Medicaid eligibility, please make sure that you have everything ready. You're going to need their social, their MBI, their Medicare beneficiary ID, their date of birth, and their first and last name. Okay. If you're looking for doctors, you can also call in to check doctors and get their ID, but make sure that you have the exact spelling of the doctor's name, what county they're in, and the zip code ready, just in case. Also, they do ask that you limit eligibility lookups for less than 5 people on a call. So don't, bulk say, oh, I'm going to check like 5 different people. Keep it under 5. And then the last thing is if you are calling to speak with management, please make sure that you have your ID ready and a brief description on what you're calling about, so the managers are ready to take that and escalate that as well. The agent services reps are not there for member services. This is different. They're there for you, the agent. So try not to have a member on the line with you when you're calling broker services. You don't want to do that. Now, you can be on the call when you're calling with member services to, with Freedom. You can call in with you yourself on the line with your member, but it is not great to call in with your member to broker services because they're going to say some things that may not pertain or might cause some misinformation for your member. So don't do that, okay? And this is pretty much standard across the board. I do know that there's a couple carriers that you can go into your portal and check Medicaid status as well. Remember, guys, this is going to be a very big thing this summer, starting on Saturday. Here in Florida, we're already launching letters out to those folks that are currently on Medicaid that might need some extra help, and they're all going to need to reapply. So get in front of those calls. I do know that our team is organizing books of business right now, pulling down your DSNP memberships, and we're going to be sending those out back to you because your DSNP members are the ones that are going to be impacted by this Medicaid redetermination. They are going to have to reapply for Medicaid. If they fail to reapply for Medicaid, they will be kicked off of their DSNP plan, and then you have a lost member, okay? So I can't stress this enough. Please make sure that you get to your DSNP members as soon as possible, have that conversation, let them know what's going on, and let them know that you're there to help them reapply. Okay, now you guys know how to reapply them, and we're here to help you with that. For all other member services, please remember that we're using the Spark platform, and Spark is here to help you with that. As far as getting members taken care of, getting the things that they need, okay? All right, so we're right at time here. I wanna thank everyone for being on the call this morning. Please remember that this is the last week of OEP. Make sure that you've got everything you need to have a successful closeout here. And I really do hope that everyone has a fantastic week. And John is mentioning here, you might have more DSNP clients than you realize. So I do thank John and the team for compiling the DSNP members. Get with us, and so we can get you back in front of your DSNP members so you can get in front of this movement that's happening, not just here in Florida, but across the country, okay? We're happy to help in any way we can. Please let us know how we can help. We wish you a fantastic week. Go out and kill it for OEP, and let me know what we can do to help. Thank you guys very much.
Justin?
Have a fantastic week.
Justin?